As an employer with over 5,000 members of staff, the Council is committed to providing assistance and guidance for its employees with regards to their health and well-being. To support this commitment, the Council provides an occupational health service. The Council's occupational health provider is Optima Health, who also undertake a similar service for other public sector organisations across Scotland, including East Ayrshire Council, North Ayrshire Council and Police Scotland. Optima are contracted by the Council to deliver a range of occupational health activities including health surveillance, risk and prevention, supporting absence management and undertaking lifestyle checks to support the Council's healthy working life strategy. One important aspect of their service is an occupational health referral. An occupational health referral may be completed by a manager after discussion with the employee about their health in a work context, and will normally be related to the Council's maximising attendance policy. Ultimately, the referral is about understanding an employee's health situation in a work context, based on expertise provided by an external and objective health practitioner. A referral will not apply to every employee who is absent or unwell, and indeed, in many cases, a referral will not be required. However, it may apply to employees in the following situations: high levels of recurring short-term absence, long-term absence, workplace injury or work-related stress, or potential ill health retirement. Why is a referral required? A referral is important for the employee as it allows them to be seen by a qualified practitioner who can objectively assess and evaluate the issues in a private and supportive environment. It will ensure the employee has the opportunity to fully explain their health situation and any impact it's having at work. It's important for the manager as they need to have all relevant information and guidance available in order to best support the employee and before making any decisions or taking any action related to the Council's maximising attendance policy. It is the responsibility of the manager to fully discuss the referral and its contents with the employee before the referral is made. Managers have access to specific guidance which outlines their responsibilities. It is the responsibility of the employee to attend any appointment as a result of the referral. Employees should not rely on occupational health as a form of healthcare. An occupational health referral is not intended for diagnosis or treatment purposes. Therefore, employees should always contact their GP where their health is affected, and also check to see if any insurance policy they have may provide additional cover. The referral will contain the following information: the employee's previous absence history, confirmation of the reason or reasons for the referral. Example reasons might relate to short-term or long-term absence, a workplace injury or illness, or the ability to undertake work tasks. Confirmation of the job role and type, levels of exposure to elements such as noise, vibration, manual labour, hazardous substances and night working. Specific questions that the manager needs to ask and which the practitioner will answer. Examples include: is the employee fit for work? Is the medical problem likely to be caused or made worse by current work activity? And are there any workplace adjustments required to aid the employee back to work? The blank referral template is available on the Council's intranet, The Core, and the completed referral can be viewed by the employee at any time on request. What happens next? Once the referral is completed by the manager, it is sent to HR to check and confirm. If the referral is agreed by HR, they will then input the details onto a secure electronic system which forwards the details onto the Occupational Health Service. The referral will then be assessed by Optima and an appointment time generated. It's important to note that demand for the Occupational Health Service can be high, and an appointment date may take some time. That is why employees should always seek relevant healthcare and support from the National Health Service, as they may be seen sooner. The employee will receive a text to confirm the date, time and location of the appointment. The employee should attend or advise as soon as possible if they are unable to attend. Missed appointments and short notice cancellations cost the council money and also prevent other employees being seen. At the appointment, a qualified occupational health practitioner from Optima will listen to the employee and discuss their health situation. They will then create a typed report. The practitioner may decide that a further referral and appointment with another practitioner is required, for example physiotherapy or counselling. In some cases, the practitioner may, with the employee's agreement, require further information from their GP. Where appointments are made in relation to areas such as physiotherapy and counselling, a series of appointments may be required. The initial number of appointments are limited to 3, but further appointments may be available in certain situations. In order to develop the Occupational Health Service, employees may be asked to complete a confidential questionnaire asking what they thought of the service. The report allows the practitioner to give their assessment of the situation and to answer the specific questions contained within the referral. The report is normally issued within a few days after the appointment and sent securely to HR, who will then share with your manager. A copy is always provided to the employee. The report is a summary of the situation and therefore is designed to be only a few pages long. The report is the practitioner's assessment of the employee's health from a work perspective only. The report may contain recommendations for both the employee and the manager. The employee has the right to see the report before it is shared with the council and can request changes or refuse to allow the council to see the report. That is fully within the employee's rights. However, it does mean that the manager may not be able to take into account important and relevant information when deciding on how to proceed. The manager can only ever base decisions on information that is available to them. So in summary, a referral is there to help both the employee and the manager. Managers must ensure employees are fully involved and aware of the referral. Employees must attend appointments. The occupational health practitioner is there to provide objective and expert guidance from a work perspective. Further information on the maximising attendance policy and the wider occupational health service is available on the core and also from your service HR advisor.